The best thing that a patient has said to me recently is thanking me for being there for them in a way that they didn't expect, and really just being present and available in a way that she didn't expect. Hi, I'm Dr. Sami Kalifian. I'm a double board certified dermatologist based out of San Diego, California, and I'm the co-founder of Som Aesthetics. Much of my academic career has largely been interfacing with different groups to try and push forward the boundaries of science and medicine, and oftentimes you can't do these things alone. And so whether it's collaborating as a dermatologist with my peers in plastic surgery or rheumatology or other fields of medicine or technology to try and really push forward the boundaries. And again, to me, collaboration is the spirit of medicine. And so the way I work with patients to help empower their confidence is it starts by first listening empathetically to what it is that they're after, what it is that's brought them to me in the first place. When you listen empathetically to people and listen to their emotional experience around whatever it is that has brought them to you, you can really start to understand and discern what it is that they're after. So my patients may not have the language to say, Dr. Sami, can you treat my nasojugal groove? But they may say, Dr. Sami, I feel like I look sad, or I feel like I look tired. And I can translate that emotional experience into a cosmetic outcome and therefore empower their confidence and give them back what it is that they had lost or what they're seeking. So social media is definitely affecting patient expectations with filters creating very unrealistic outcomes for patients to smoothen their skin and brighten their skin and give them these cheeks and lips that are not real, they're not natural appearing. And it creates these paradigms that are really unrealistic for patients to achieve, but it sets these expectations in their minds. Also in social media, we have the advent of both misinformation being propagated, as well as people of some stature or platform suggesting that, they either have not had things done or things are good or bad when they really shouldn't or don't have the credibility to make those sorts of assertions. And so it becomes a bit of an echo chamber in some ways. When I first started my career, I was very anti-social media and I didn't want to participate. And I felt that I didn't like to self-promote, I didn't like to self-aggrandize, and I felt that there was a lot of noise in this space and I just didn't want to participate. And part of it was that I didn't feel like I knew what my voice was within social media. And so once I figured out what is actually my voice, it became very easy and natural for me to participate. And what that voice was educator. When I could speak to people who were listening to me in the role of an educator who was trying to bring forth, science and data and evidence to support claims and teach people techniques and paradigms so that they can understand what is real and so discern for themselves what the best path forward is.